Hello, I'm Dr. Frances Pitsillis. As winter approaches, or if you're right in the middle of winter, you're going to be interested in not getting sick. Well, the fundamentals are always going to be looking after yourself generally, like getting enough sleep at the right time and being in bed and asleep at 10:30, having a good varied diet with lots of different colours of fruit and vegetables so that you can get all your vitamins in there, getting enough rest, not getting stressed because that helps your immune system, doing enough exercise because that helps your immune system too because it increases natural killer cells. Now, talking further about your immune system, what supplements can you consider looking at so that you can protect yourself, support yourself, or even help yourself to get better should you get sick? Well, the first one people think of is vitamin C. It's an antioxidant, it's an antihistamine, and it definitely has been known to reduce the severity of a cold. In fact, taking up to 2,000 milligrams a day can protect you, and this is known from research. Another very important consideration is vitamin D. Vitamin D is usually something that we get from the sun, and of course there's less sun during the winter. So knowing what your vitamin D level is through a blood test can be useful, and then optimizing your vitamin D level may be of some use to you. This is because when it comes to the respiratory system, vitamin D helps with lung function and reduces pneumonia, colds, and flu. So it is important, particularly if you're quite vulnerable at winter time. Now, while you're there, you may want to make sure you take a sunny holiday in the middle of winter as well. What other things can you consider looking at? Well, zinc is very important for the immune system, and zinc also reduces colds, flu, and pneumonia. There's a simple test that you can do at the shop called the zinc taste test, and it's a guide as to whether you've got enough zinc in your system, because those people who haven't got enough zinc can't taste it. Now, the other thing to consider is selenium. Large areas of the world are deficient in selenium, and it may well be adequate to have 1 or 2 Brazil nuts a day because they contain a lot of selenium. But selenium is a very important antioxidant. Magnesium has a small role in colds and flus because it has an antihistamine effect, and it also has an antioxidant effect. Taking it at night will also help you to sleep. Now, some of the tests that you can test with your family doctor include iron. Iron is important for the immune system, but indeed it is the most common deficiency around the world, and in particular in children and in fertile women. Correcting iron deficiency can have an amazing effect on your immune system, and having had lots of infections actually drain your iron as well. Now, natural substances that you can take to help you when you get an infection might include echinacea, astragalus. But we do know that olive leaf extract has quite a powerful effect on flu and colds, and this is mainly because of its ingredient called oleopurin, which is very powerful against bacteria, influenza A, parainfluenza, and many of the common cold viruses, including myxovirus and rhinovirus. Now there's a mouthful. And even Staph aureus that often gets into people's chests. So it's not just about healthy diet and lifestyle, it's knowing that you're not deficient in anything and checking with your doctor. And there are some herbs, including olive leaf extract, that can be helpful.